When the kid is mingling with a lot of group of kids, definitely. When will you call a child has a fever? So by touching and by feeling warm, it is not fever. Not eating or drinking well and is very tired and not active, and that is when Good afternoon everyone. A lot of my patients nowadays, they inquire about their children's health. The kid is falling sick frequently. They suffer from cold, cough, fever. Frequently they are getting infection. Once in a month at least they are suffering from these problems and cutting the school. Lot of queries regarding the respiratory tract infection among kids. So today we are going to see in detail about what that is and how effectively we can do home remedies and prevent this infection and how to manage when the kid is suffering. First of all, we should all remember that the kids are not exposed to the general public for the past 2 years. They have not gone outside. Maybe within their compound they were playing, but first time after 2 years they are going to the school, getting exposed to kids of various level of immunity. Each kid has its own immunity. When the kid is mingling with a lot of group of kids, definitely there is a chance for cough, cold and fever. So first thing should remember, you shouldn't panic when the kid is suffering from cough, cold and fever. It is not good, I understand, but still immediately don't panic. Even parents are asking me, because there is no COVID vaccination in India for the children, is the kid is suffering frequently. No, don't confuse yourself and self-diagnose yourself. See, first of all, common cold, cough, common viral flu, all these are common among children. That is how the kids develop immunity. So we should actually feel happy that the child is struggling, it is developing antibodies on its own. So nothing to panic when a kid is suffering from cough, cold and fever. I will come and explain each and every symptoms. First is fever. When will you call a child has a fever? So by touching and by feeling warm, it is not fever. You should measure the temperature. Only when it crosses 100 degrees, you should definitely say that the child has fever. Because as a mother, we definitely panic when we touch and the child feels warm. Immediately child has fever, we have to give medicine, we have to go to the doctor. Don't panic. When the temperature is more than 100 degrees, nowadays digital thermometers available everywhere. You can measure in your house itself. When it crosses 100 degrees, you can give paracetamol. Paracetamol is the safest of the medication available with less side effect. You can give the child paracetamol every 6 to 8 hours depending upon the symptoms and depending upon the symptom relief also. So even after giving paracetamol, some kids will still have fever and associated body pain. For them, under doctor supervision, according to doctor's advice, you can also give some medications like ibugesic and mefenamic acid. But remember one thing, they can cause acidity. The child can suffer from tummy ache. So always give some food before giving such medicines. So when the child is suffering from fever, the child won't eat properly. The child will not eat anything and the child will feel dull. The child will lose weight. For that also, please don't panic. You don't have to feed the full quantity as before when the child was not well. So always give small frequent meals. If the child is not eating solids, try to give liquids, that is fine. Soups, rice water kanji, idli with milk, something bland, light, less quantity is also fine. Throughout the day, let the child sip some warm water. Water, you can add little bit of tulsi leaves. It will be like a flavored water. Any child will drink. It will not have any taste also. So keep giving the child warm water mixed with tulsi leaves. Keep hydrating the child. That is very, very important when the child has fever. As long as the child is active, playing, just a fever, don't panic. Don't panic and go to the doctor immediately. Fever can last for 3 to 4 days. Absolutely nothing to worry. If it is getting controlled with paracetamol, you don't have to panic. And you can also give depit sponging, like you can mix a cotton with a normal tap water. Don't give fridge ice cold water, normal tap water, and you can keep sponging the children. In spite of that, if the temperature is not coming down, definitely you should go and meet the doctor, because most common cause of fever which is dangerous is two conditions. One is dengue and another one is H1N1 influenza virus. So those two fever has to be diagnosed as early as possible and treatment should be started. Definitely those two will take 3 or 4 days to get it confirmed in the blood test. So you can delay for 2-3 days, nothing to worry. Manage in the house with paracetamol, normal liquid diet and depit sponging. In spite of 3 days of home care management, if the child is not recovering, bring it to the notice of the doctor and get the child checked for dengue and influenza. Prevention of dengue and influenza also you should remember. Influenza, we have vaccines available starting from 6 months of age for the kids, as well as until adults. Everyone can take influenza vaccine. You can inquire your doctor about the vaccination, schedule everything. Once in a year at least you should take H1N1 vaccine, because it is very dangerous infection which is vaccine preventable infection. Dengue prevention, you all know, try to wear fully covered clothes for the kids. Avoid mosquito exposed area like park, wherever the mosquitoes are common. In your house also, if there is any fresh water which is stagnant, try to remove it immediately, because the dengue mosquito grows in fresh water. So all that is very, very important for dengue prevention in kids. Once the dengue is diagnosed, immediately don't panic. There are lot of infection, lot of types of dengue fever. Only one is very, very serious, dengue hemorrhagic fever. Otherwise, most of the dengue infections that will be managed with paracetamol and hydration, lot of liquids. If the child is not eating or drinking well and is very tired and not active, and that is when the doctors will help you with admission in the hospital and IV fluids. Until then, when the child is sipping little bit of fluids and liquids, some liquid diet like soups and kanji, don't have to panic at all. This is regarding fever. Other things are cold and cough. Yes, the kids cannot cough and bring out the sputum. So when they cough, they vomit. That is also very normal. Through the vomit only they bring out the sputum, that expectorant. So don't panic that the child is vomiting 3 or 4 times in a day. As I said, as long as the child is active, you don't have to worry. You can give some cough suppressants or cold remedy medications according to your doctor's advice. So this is very, very important, and try to not to start antibiotic as early as possible, because development of natural immunity happens in the childhood. So as soon as immediately if you start the antibiotic, it is actually not good for the kids, immediate exposure of antibiotics. So only when it is unmanageable, like 3 or 4 days of persistent fever, child is not recovering well, then according to doctor's advice, we can start antibiotic. Don't be in a hurry to start antibiotic.